Thank you so much for coming to this continuing education event. My name is Dr. Kim Dennis. I'm the co-founder, CEO, and chief medical officer at SunCloud Health. Just a little bit about us. We treat adolescents and adults. For the adult population, we have 2 residential units treating complex multimorbidity patients using an integrated model. One of our residential units is non-specific, and then the other residential unit specifically treats patients with the co-occurrence of eating disorders and addiction. We have 3 adolescent sites, including Lincoln Park, this site that you're in right now, and Naperville, where we offer intensive outpatient and PHP, again, for patients with mood disorders, eating disorders, addiction, and co-occurring trauma, using an integrated approach. And I am delighted today to be able to offer this educational event and to have Dr. Kevin Sabet with us. He is a big deal. An affiliate of the Institution for Social and Policy Studies and the Medical School at Yale, and dubbed by NBC News as the prodigy of drug politics. He's an author, consultant, and advisor to 3 U.S. presidential administrations. He's studied, researched, written about, and implemented drug policy for 25 years. You're not that old. He is currently the president and CEO of the Foundation for Drug Policy Solutions, FDPS, and SAM, Smart Approaches to Marijuana, 2 nonprofit organizations he founded with Congressman Patrick Kennedy. His latest book, Smokescreen: What the Marijuana Industry Doesn't Want You to Know, is distributed by Simon & Schuster and won the Next Generation Indie Book Award in the social justice category. It's been, there's potentially going to be a documentary film by a Hollywood studio based on this book. His upcoming book, One Nation Under the Influence, will be published by Polity in 2024. He's the only person appointed by both Republican and Democrats to work at the White House Drug Office. He's a columnist for Newsweek and received his doctorate from Oxford and a BA from the University of California, Berkeley. He's going to talk to us today about marijuana, and we're going to start off with a case presentation, because I know a lot of you are clinical folks. And that case presentation is going to be done by our child and adolescent medical director. That's Alex Chevalier. Dr. Chevalier is a board-certified adult, child, and adolescent psychiatrist. He completed his medical training at the University of Wisconsin, followed by adult and child and adolescent residency and fellowship at UIC. He's worked across the lifespan, both in acute inpatient as well as traditional outpatient facilities. He treats a wide variety of psychiatric disorders, including mood, anxiety, substance use, neurodevelopmental, and childhood trauma. He has been our child and adolescent medical director for the past 2 years. Yeah. And has been with us, really helped us to launch our adolescent treatment services for the last 3 years. So without further ado, I will hand it over to Dr. Chevalier, who will then hand it over to Dr. Sabet.
So before I get started, I just want to thank everybody for coming here today. I am very excited to be having this discussion with you this morning, and more excited to listen to Dr. Sabet after I finish. I'm just going to get things rolling for a couple minutes here to give everybody an idea a little bit about what's at stake and discuss a patient actually who's been through our treatment center relatively recently here, just to kind of highlight a little bit about how cannabis itself is intersecting with the current generation. Actually, a parent I had a few weeks ago, I think pretty aptly described this as the epidemic for this current generation. It's just that we're not describing it now. We're going to think about that 10 years from now. And of course, our idea is to bring the future to now and make sure that we're really highlighting what's already happening. Right, so this patient here today is going to be a 16-year-old female. She had completed 2 previous PHP and IOP cycles at other facilities that were not at SunCloud. So had spent actually several months of her life in what we call like a higher level of care, this PHP, IOP setting. She had also had extensive evaluations done by outpatient psychiatry and had been seen for multiple outpatient sessions in addition to the 2 separate times in PHP and IOP. She presented with comprehensive diagnoses of major depressive disorder and generalized anxiety disorder. I say comprehensive in that that's all any of the notes ever said about her diagnoses. We'll talk a little bit about what else was going on. And of note, the big things and the big concerns were these recurrent self-injurious behaviors and her description of recurrent, largely passive, but at times active suicidal ideation. When she came in for initial evaluation, the following were things that were noted on exam by myself. She'd been struggling significantly with food restriction, and that was a new behavior for her over the last 18 months. As a result of the time that she was going through the food restriction, she was also finding that she was binge eating, a common scenario that we find in people who are restricting their food intake during the day. She struggled dramatically with her body image and was spending virtually the entirety of her day thinking about food or her body. I always survey patients to see where they're at, and she was describing about 80% of her day being spent thinking about food and body image. Her weight had gone on a bit of this kind of classic yo-yoing where she had gained approximately 15 pounds, and then the food restriction portion had kicked in, and then she lost about 15 pounds despite those weekly binge episodes. And around the same time as this was going on, she received her first THC vape pen at school. And she quickly escalated to the point of using a cart a week. For those of you not familiar, that's a pretty significant amount of THC, say severely significant amount of THC, and she was not really able to stop using. So the longest that she had gone over that time frame without use of cannabis was 2 weeks. She had significant physical and psychological withdrawal symptoms during that time and was heavily interested in not being in that state. The severity of her symptoms, with the anxiety in particular, had led to her having full GI workup. This is a kid who'd been, underwent endoscopy and had a, GI specialist, put a scope down her related to the concerns around her stomach. And what was really later identified by me here, was a lot of this was driven around concerns related to social situations, specifically in crowds. It was not a generalized anxiety that was occurring throughout the day, but of course, as teenagers, them being in situations with social judgment being present and fear of embarrassment being a possibility, of course, comes across as a general time frame and is a daily occurrence for them. Her mood symptoms were specifically dominated by apathy, low energy, and this was particularly noted with a precipitous drop-off in her grades. So she had previously been a strong student and then had grades that up to and including failing from being more in the AB range prior to that moment in time. Another pertinent part of her history is that she was a survivor of sexual assault relatively recently in adolescence by people known to her from school, and then also physical abuse as a child by a caregiver. So I'm going to just ask you to hold this patient in your mind. I'll give you a brief wrap-up after Dr. Sabet finishes, and we'll think a little bit more and talk a little bit more about that case. So my great honor to have Dr. Sabet take over from here.
Thanks so much. Thanks. Appreciate it. Great. Well, good, I guess, almost noon, everybody. It's wonderful to be with you. It's honored to be here and talk a little bit about the marijuana issue and really get into also some questions that you might have. I'm going to touch on both policy and also the sort of physical, biological issues that we're seeing. But SAM is the group. When I left the Obama administration, we decided to start something to kind of raise awareness about what was going on in this country 10 years ago. We started it just about the marijuana issue because it's something that's clearly changed over the years and become a lot more accepted. In fact, recent surveys confirm that most Americans think THC is the least addictive of any substance, including many legal substances, including sugar, including multiple things, erroneously believing that. And we're now seeing very high levels of marijuana use disorder or addiction that we had never seen before. Even when we had high levels of use in the 1970s, which we did, we had not seen those levels. And actually just yesterday in the New York Times, there was a large article reporting on a JAMA study that just came out showing 21% of those who were using marijuana met the definition of addiction. That didn't make it into the slides because that just came out yesterday. But that's what we're trying to do, is raise awareness, talk about these issues. We collaborate with all kinds of medical groups, law enforcement, treatment, prevention, really folks from across the country. And the main point I try and impress upon people, whether I'm talking to a 16-year-old who has questions, whether I'm talking to a parent or professionals and community members like you all, is that we're not really talking about the marijuana of the past. It is true that we have had high strains of marijuana. We call that hashish. That's been around for thousands of years, originating in the Middle East. But that's a sort of obscure kind of marijuana. It's not really something that is heavily consumed in this country. We don't really have a tradition of that. It's hard to grow here, and it's just not something that's in our culture. But what we have now here are just an array of products based on the active ingredient in marijuana. And the active ingredient, of course, is THC. Marijuana is a very complex plant. It has hundreds and hundreds of components in it. The components that act on the brain are called cannabinoids, and the one that binds to the receptors in the brain that makes you feel high is called THC. And that's the one that we also know the most about. And so what now with the normalization, and really I call it the commercialization of marijuana. It's not so much legalization. Yes, it's legal because it's commercialized, but it's much more than legal. With the commercialization of marijuana, we now have an array of products that we've just never had before. We've never studied, we don't have experience with, nowhere does. And really kind of leave it to good old American innovation for coming up with the products that the rest of the world never have seen before. The drug cartels could make. It's true. They couldn't. They wouldn't, and they couldn't, and they still don't. But this is happening right under our nose, under the stamp of approval of legality, which is really, really, if you just think about it for a minute, it's a fascinating development, because if you look at where we are with smoking cigarettes and nicotine in this country, we had candy cigarettes that didn't have nicotine in it, but mimicked the use for young people. We never really had the products like this on nicotine, but certainly we have obviously a long history of big tobacco influence. But in the last 20 or 30 years, we've really made incredible, probably more strides in this area of public health, and I would say any area of public health. I mean, maybe you could put sort of our advances in HIV/AIDS close to it, but even that I wouldn't put as much, given that 20 years ago we had 45% of Americans having used nicotine in the last year, 30% were regular users. We've never had an HIV incidence obviously that high in this country, so that's why I think the strides that we've made on nicotine are really incredible. If you told people 30 years ago that we would be banning smoking in restaurants, people think you're crazy, because at least when I grew up, and most of you were, spring chickens young, so you don't remember this, but some of us might remember going to the restaurant and, the first thing they say is smoking or non, right? Or when you bought plane tickets, we somehow thought that, the difference between row 14 and 15 was so dramatic in smoking. There was a smoking section and a non-smoking section. And we laugh at this, but this happened in our lifetime. This isn't ancient history. And we made an incredible 180. Mainly for a couple of reasons. One, we finally figured out that we were being lied to for 70 years by an industry that knew very well. They knew in the 1930s, not just in the 1960s when the government admitted it, but in the 1930s they knew that nicotine had carcinogens and cancer-causing material that were not naturally occurring, totally artificial, totally unneeded, but were being put in cigarettes to make them more addictive and really affecting the health. They knew that they were targeting youth. They have completely admitted it now. At the time they denied it. They said this is for adult use only, which that sounds kind of familiar. And so the point is, we have made such dramatic inroads on that. And yet we are rolling out the red carpet for this industry. That is something I just don't understand, the cognitive dissonance socially. And so marijuana has become so much more potent than it used to be. One of the main reasons it's become potent is we have much just better agricultural techniques now than we did even 30 or 40 years ago, and we have the innovation for mass production and manufacturing in the marijuana industry that's in America. And so we have figured out how to have somebody consume something that's near 100% pure THC. And really, when you think about smokable marijuana, you're never really going to get very hard to get higher than 30 to 40%, and that is very high. I mean, that's the stuff that we called, BC bud from British Columbia, or some of the strains grown in Hawaii. It has to be a very certain kind of environment to even grow that high marijuana strain. But now we're seeing just the ubiquity of, double the potency of the highest you could imagine in smoking, and more than double, close to 100%. So it's stuff that looks, a lot like this, which, the average parent, and this is part of the cognitive dissonance too. I think, for baby boomers, which is still the biggest voting bloc, their recollection of marijuana is the stuff, as a joint, is something that was used, when they were in college, very occasionally. Their recollection is not, they don't really a lot understand, unless now there's a growing number that visit marijuana dispensaries, but generally the experience of marijuana is very different than the average experience of a young person now, or a new person who's going to a dispensary or going to a pot shop to get marijuana. So their idea of marijuana is just not really in reality with what's happening right now. And so when parents see a blowtorch being used to vaporize and create this shatter, for example, and to inhale what we call butane ash oil, and has many other names that can be up to 99% THC, these concentrates, it's very hard for a lot of people to even identify what this is. That's why the case study Dr. Chevalier brought up about the issue with the carts, the cartridges, or what kids call carts. Those, for most parents, are totally like foreign objects, and they could be so easily hidden. In the past, you had to hide in the boys' bathroom and smoke a joint and hope that no one came in for at least 15 minutes so the smell would go down. With this stuff, there's no smell. You can put it in a highlighter pen. It's just a completely different situation. And I think that's why also a lot of voters have been deceived into voting for this and supporting this, because they're thinking of a marijuana from the past, and they're also thinking about, and we'll touch on this a little bit, they're thinking about the social justice aspects, maybe about imprisonment and sort of the war on drugs. They're not really thinking about sort of the reality of marijuana today. This is one of these issues I think it's really important to point out, where you have generally a scientific consensus that marijuana is something that should be discouraged at the very least, and that legalization is probably not a good idea. And that there is this, and I'm going to go through some of the links, but links to some very specific things like psychosis, schizophrenia, and I'll talk about some of those. And it's there's somewhat of a debate on the margins about how significant is it and in what setting. Generally, though, there's a lot of agreement. And so this is an area where you have a Republican Surgeon General, the last Republican Surgeon General, agreeing with our current Surgeon General, who also, by the way, was the past Surgeon General, Vivek Murthy. He was a Surgeon General in the Obama administration when I was there and throughout the administration, and then he was asked to do it again. So he's the current one under the Biden administration. This is maybe, you could even say, a rare point of agreement among three vastly different presidential administrations: Obama, Trump, Biden. But it's not controversial to them. It's not like, the current Surgeon General and his advisors ooh, we can't really say this because we would agree with this guy, and that's not a good look. That's not really what's the reality at all. The reality is that it's not controversial in scientific circles to say that marijuana is dangerous, it can be addictive, we should discourage it, and especially your developing brain, it's not really good for it, and it's linked to A, B, C, D, and E. That is not controversial. That is very close to saying the earth is not flat. That is just not controversial. And yet, to the average American, that's very controversial, right? It's just one of these weird things. It's not that weird, though, if you think about the money and the political sort of muscle that has gone into legalizing and legitimizing marijuana. There's been a lot of money got into that campaign. And so it's not that surprising when you look at it that way, but it is surprising when you see actually, wow, okay, this is something where the NIH, the WHO, the CDC, Republicans, Democrats, every living Surgeon General, every living head of NIH, this is not, they're not disagreeing on things on this. And so the Surgeon General was asked about this actually last year, and was very frank about this, which I really commended him for, because in this political environment, it can be very difficult to talk like this. But obviously, he doesn't care. He's the nation's top doctor, and he's telling it like it is from a scientific point of view. The incredible thing that's happened over the last 20 or 30 years is not just the number of people who've tried marijuana, that's gone up, or the number of seniors who use it, that's gone way up from the past, but just the number generally of Americans who are using marijuana or marijuana products on a daily basis. So that number's changed from about less than 1 million in 1992 to 15 million today, and actually more than that. And if you think about, I'm going to present an analogy, maybe it's confusing, but the way I think about it, it was presented to me like this by John Calkins, who's a brilliant researcher out of Carnegie Mellon. The way he put it was that if we think about caffeine, like a difference in caffeine consumption, the typical marijuana user 20 years ago was consuming the amount of marijuana, if you think about like the amount of caffeine found in one 20-ounce bottle, like a single 20-ounce bottle of Coke, versus fast forward 20 years later, today, the average, so this is not like the outlier, this is the average marijuana user, is consuming, if you think about the caffeine equivalent, like marijuana caffeine, is consuming 33 Starbucks Grande cappuccinos worth of caffeine. That's the difference in the THC consumption today versus 20 years ago among the average user. And so that's why I think that's what's startling, is that you have the percentage of people who say, yeah, I've tried marijuana in this last month, or I used it this last month. The percentage of those people who keep their hands up when you ask them, well, do you actually use it every day? Like not just once or twice a month, like did you use it every day? About half of them keep their hands up. That is remarkable, especially when you compare it to a drug like alcohol, where only 1 in 10 people who've drank in the last month are drinking every day. Which is interesting. And so it's just a huge difference in the number of people heavily consuming. And I think that is worrisome. Among any age, that's worrisome. And I like to, impress upon people, I'm not talking about the adult who's, smoking a joint once a year on their birthday in the privacy of their own home. But I think that's often when Americans are asked about this issue, that's kind of what they think about, right? They don't think about some kid dabbing with a blowtorch every day or hiding a cartridge, right? They're thinking about like at a party a few times a year, what's the big deal? Okay, I'm gonna vote for this. That's what they're thinking about. And it's this cycle, because then politicians and many of their advisors are saying, you better get behind this, because all the young people and frankly all these people want to do it. And so you better get behind it. And then they get behind it, that spurs this industry, which innovates and encourages heavy use, and you just have this cycle. And I think that's really, really, really worrisome. So it's worrisome because when it comes to the brain, we know that we have basically catcher's mitts. We have receptors that are ready to catch that molecule throughout your body and of course in your brain that catch that THC and give you that feeling of being high. And we know where those receptors are. They're all over the brain and the body, the rest of the body. And it's important to know that because for a couple of reasons. Number one, just to realize what parts of the brain are being affected, that matters. But also to remember that, our brain and SunCloud can explain this better than I can, but is developing until about age 25. I think even they're thinking later now, maybe I've seen. And so anything that gets in the way of, if you think about a brain developing, I like to think about it as like a plant that's growing that, is constantly being pruned and sort of watered and tended to and just kind of made perfect as it's growing in its formative stage. And if you think about that happening naturally to everybody, and then anything that affects that or, anything that comes into being with that brain has a potential to affect positive or negative. I mean, a positive example would be, if you're going to be good at a sport, you're probably going to learn most people are going to learn it at a young age and keep going with it while your brain is developing. And then your brain picks it up, and some people are super talented and that's their, life's career or whatever. Most people who become a professional athlete don't start their sport after age 25 or even after age 20, right? Or if you learn a language, we know that, the younger the better, actually. For a lot of reasons, the younger the better. Even if a 2-year-old doesn't remember everything by the time they're 5. We know that's even helpful for brain development. But we know if you want to learn a language, it's a lot easier when you're 10 or when you're 5, 10, 15 than it is when you're 50, 60, or 70. Not that it's impossible, I'm not saying that, but it's a lot easier because your brain is just, it's a sponge. It's picking up everything. And that's why, on the negative, why we care so much about things like childhood trauma or picking up any of these kind of habits or disorders that can be very dangerous. And so when you think about a brain that's developing and THC getting involved with it, while it's developing these critical parts of your life and existing as a social human being, we know that really matters. One interesting this study that came out recently was they looked at alcohol, cigarettes, and marijuana, and they looked at young people, teenagers, depending on the number of times that they used it since the time that they used it in months. So this was the group that used, pointer will look on the TV, but the first set on the left is a group of the kids who used it about 12 months, and then the next is 12 to 24, 24 to 36, and then over 3 years since they first tried. And we're seeing the addiction rates, and this actually startled. This was Nora Volkow, who's the head of NIDA, was part of the study. It startled the best researchers in the world who have been looking at brains for the last 30 years or more, that marijuana, more than cigarettes, alcohol, and prescription drugs too, which isn't on this graphic, was actually, the addiction prevalence was much higher among marijuana, about double that than alcohol or cigarettes. So that was really interesting. We know with some research from Deb Hassan from NYU that 1 in 3 people who used marijuana in the last year meet the criteria for a cannabis use disorder, what we call or a dependence, an addiction. And that study that just came out was 21% from Washington State. So these studies, anyway, the point is 20 to 30%. That's much higher than what we thought. If you looked at the NIH website 5 years ago, it would have cited a study from the 90s, and that study showed that it was about 1 in 10, 10%. So we're just seeing the addiction prevalence rate go higher and higher as these products are out there. What's interesting is that, though, this is happening at a time where, interestingly, a lot of young people are also rejecting substance use altogether. So smoking cigarettes, as I said, is a rare occurrence now among like a high school junior or even a freshman or even later. The vaping is obviously increased. Drinking has gone down, way before legalization was starting, but it has gone down. And so generally there actually has been, like, versus the Generation X, so those going to school in the 70s, 80s, and 90s, if you look at the current generation, there's actually more of a rejection. There's more of an embrace of like healthier lifestyles, et cetera. But what's interesting is that in legal states, researchers are finding that having commercial marijuana, especially having a marijuana store near where you live, or even just access to it, is really pushing up against what really generationally has been a general downward turn in substances, which is good. We want there to be a downward turn, but legalization, unfortunately, is pushing it back. We're seeing cannabis use disorder. This is a study by Magdalena Cerda at Columbia, finding that basically 25% there was an increase of 25% of cannabis use disorder among teenagers in states that had legalized marijuana. And we don't have a good term for this. I don't like the term recreational, even though you'll see it on my slides, because to me, recreation is not using substances. It's like pickleball. No offense, I know it's a sport, but people like pickleball now. But that's recreation to me. I'm a tennis player, clearly, so I have a thing about pickle. But that's recreation, right? Or ping pong or something. Drugs, recreation. I don't love that. We're still using the terms and its terms are very important, and we struggle with them. One of the best terms, if you were a PR person for the marijuana industry, was the term medical marijuana, because you could put the word medical in front of it, and then it sounded like it was good for you. So how can something be bad for you if it's good for you, right? Side note, just in case you're thinking, I do think that there are, and science has shown, there are medicinal properties of marijuana that can be used in very specific situations among very specific patients, very specific formulations. But this mockery of what we call medical marijuana, where you go into a pot shop with a guy that his only experience with marijuana is that he uses it, not that he went to medical school or a pharmacist. And there's a sign that says medical this way, recreational this way, and it's the exact same products. One is just taxed at a slightly different rate. That's not medicine, folks. That's not medicine. Also, what's not medicine is having a separate store that only sells that product. That's always, to me, what boggled my mind. Like, we don't have Advil dispensaries, right? We have a pharmacy where you go and there's an array of medications and you talk to a professional. I get that they're cannabis professionals and they're cannabis baristas, whatever they're calling themselves these days, but it's incredible. But my point of saying it is, terms matter, and it was such a brilliant term that basically came about 30 years ago by putting the term medical, because in people's minds, and if you survey Americans today, 90% of Americans agree with medical marijuana. It's because it's being presented in a way that's compassionate. It's being presented in a way that, hey, you might need it someday for cancer or something. And so we kind of say, all right, well, in that case, we should. If it was only for these kind of very serious illnesses, I think we'd have a different conversation about it too. But clearly, it's really for no state is really restricting it. It's really for any reason at all. So that's a really side note that I wasn't going to get into. But so we are seeing increases in youth marijuana use. I'm going to go forward. I don't want to focus on that, but we are seeing increases. We're seeing really devastating research come out of the UK. Some people say, well, this is, research is American and it's biased against this, and NIDA only looks at negative research, research that shows the harms, doesn't show the benefits. I'm not just quoting US research here. I'm quoting research from around the world. This is a very prominent research group out of King's College London. And basically what they found, they have a clinic in London, in South London, where they deal with mental illness. And they're finding that if you are using what they call skunk, because it smells like a skunk, that's the British term for high potency marijuana, believe it or not. Skunk there is about 15% THC, so it's actually not what we have here, but they consider it, because it is very highly potent. Unless you're using marijuana every day, 15% is plenty potent. That's also why when we go to states and say, okay, you've legalized it, we get it, will you limit the THC levels at least? Because do we really need 99%? You don't really need that, but obviously the industry, the last thing they want to do is have any limits. So we've been unsuccessful in that. But they found that 15%, you were 5 times more likely to develop psychosis. By the way, 3 times more likely still if you use lower potency, which there was like less than 10%, I think, or something, which is difficult to find here, by the way. If you want to find marijuana that maybe your parents used and that was 5%, that's difficult to find. It's not out there at all. It's dominated by highly potent strains. We're seeing all kinds of things. When there was a survey of over 1,000 24-year-olds found that high marijuana potency users of high potency marijuana were 4 times more likely to use it in a way that was not good at all, very heavily, and then twice as likely to develop an anxiety disorder, twice as likely to use other substances. And you might be thinking, well, is that the gateway theory? Hasn't that been debunked? I don't like the term gateway. I think it's a term that's just kind of used. It's been said so much and overused that people don't, it's hard to even come to an agreement about what that means. But if you look at sequence of use, there is no denying that over 95% of people who are using cocaine, methamphetamine, or any opioid, that their starter drugs were alcohol and marijuana. That's and much more than it used to be, and cigarettes, but not anymore. Alcohol and marijuana. And why is that? Is that because, some people would say, well, maybe it's because, they use marijuana, and because marijuana is illegal, they were on the underground market, and then they got access to other drugs because their dealer, has marijuana and other things. It's a great theory, but that's not really how the marijuana market works. The vast majority of young people using marijuana get it for free. They get it from family members or friends. They don't go to the shady character in a 1984 TV commercial, who was like, "Hey kids, want to get high?" and like had an array of drugs in their trench coat. That's not really the reality of it at all. In fact, it's really scary when you look at the parental link to young people and how they're starting to use the rates of parental introduction of these drugs is very high, especially in certain communities. It's really, really disturbing. But point being, we think it's more about just the fact that when you dip your toe in the water a little bit, there's a point where for a lot of people, and now biology is showing this, THC just doesn't do it anymore. Even the high potency stuff, your brain wants something bigger and better. Not everybody. The majority of people who use marijuana will not use other drugs. Let me be very clear. But the vast majority of those who do use those other drugs, they did start with marijuana. That was their first illegal drug of choice. And so we have to watch that. And we're now seeing actually marijuana being associated with tobacco use again, sort of reintroducing tobacco to a generation that was not using. We're also seeing the co-use of alcohol and marijuana very high. So one of the theories was, well, let's legalize marijuana so that people drink less, because drinking is such a bad problem. And so maybe they'll drink less and they'll substitute. We're not seeing substitution by and large in any of these states that have done this. We're seeing alcohol revenues and sales go up as marijuana sales and revenue go up. And anybody working with young people or on the clinical side will tell you, like, duh, that's what happens. It's not like, the kid says, well, oh, I'm a complete abstainer of alcohol. I just only use marijuana. I mean, maybe some do, but that's not really the thing. And that's also where I think parents do come in. I think some parents mistakenly think that, well, if they do it under my roof, at least I'll have some control. And that's something that adults like to tell themselves to maybe feel better about something, but that's just not the reality at all. When you're doing that, you are sending the message that this is totally okay. And if you think that your 16-year-old son or daughter is going to say to their friends, I can't have that beer with you, I only do that with my dad. You need to learn something about young people, because that's not happening at all. We see a reduction in IQ where the famous study that came out about 10 years ago now, showing an increased risk of an 8-point loss in IQ among those who are using regularly. And what's interesting about that study is it caused such an uproar in the scientific community, and especially that people said, well, that can't be right. We're going to redo it. They redid the study. This found the same thing. Then a group out of Norway who had a history of wanting to legalize drugs said, well, we're going to redo the study and show that that's false. And they couldn't even do that. And so when controlling for socioeconomic factors and controlling for a lot of things, this research group, led by Madeline Meyer, found that there was an increased risk of an 8-point loss in IQ if you used, sort of 3 to 4 times a week for 3 to 4 years of your adolescence. And what's interesting about that is you think like 8 points, like what is that? That's enough to make you go from an average student to a below average student. That's enough to take you out of contention for about 75 universities. That's millions, could be millions of dollars of lifetime income. It's a big deal. 8 points is not a small number. Doesn't mean that it happens to everybody. It means it increases your risk. And it's like, I want to use this analogy that I hope you can use too when you talk to folks. A lot of people will say, well, that, the 8-point reduction or the psychosis or any of these things, Kevin, I know plenty of people who use marijuana and they're just fine. They're professionals, or young people even will say that. I'm a straight A student, and you've heard that. I'm doing great, and good for them. But the analogy I like is to think about speed limits. None of us in this room have ever sped. I know that, right? But some people are known to have sped before on freeways, and they have surprisingly lived to tell about it. And what I'm getting at there is that just because you have done something like speeding doesn't mean that we should get rid of speed limits or that speed limits don't make sense. In fact, the majority of people who get into a car accident that don't wear seatbelts, they live. That doesn't mean we're going to start to have a campaign that says, you don't wear seatbelts because you'll probably live, right? We would never have that campaign. The majority of people who smoke cigarettes will not get lung cancer, by the way. That doesn't mean that lung cancer isn't tied to cigarettes, very clearly in any kind of model you can think of. Of course it is. But there are people that it doesn't necessarily mean that's always going to happen. And so, yes, you can go over the speed limit, but that doesn't mean getting rid of seatbelts. Yes, you might be able to not wear a seatbelt and even get into a car accident and live. That doesn't mean we get rid of seatbelts. And so this idea that, yes, maybe some people have used this. Yeah, they have, but that doesn't debunk what the science is showing, what these strong connections are. And these strong connections for young people and for families, they're risks. And it's just sort of how much of a risk taker are you? Like, do you want to really keep rolling the dice on this is the question. And some people will keep rolling the dice and they'll get really lucky. That definitely happens, but they're getting lucky. They're going against the odds. And if you can beat the odds, good for you. But you should know what the odds are. And that's kind of what we're trying to say is at least let's have a fair and honest conversation with the American people. Like, we get people will want to do what they want to do in this country, but at least know what the odds are. At least know what the facts are. And instead, we're totally in denial about the harms. We have an industry that is just like its predecessor, Big Tobacco, is completely trying to debunk studies and say that we're not sure and fund their own research actually now. And we have a huge lobbying arm in state capitals and in Washington that's reinforcing that. So that leaves us the mess that we're in now that you're all cleaning up here. And the numbers that we see that are, when you look at numbers are hard to sometimes digest. Like, our brains don't really it's like the difference between 9 and 90. That's a lot, right? But our brains is like it's 9 and 90. Like, I don't know, 9 and 80, what's the difference? The difference between 9 and 80 and 9 and 100, is that big? Our brains don't necessarily, so statistics, like we have all the statistics, but that doesn't always move people, unfortunately. And there was a quote that said, the death of one soldier is a tragedy. The death of 10,000 is a mere statistic. And that's kind of, the legalization groups have done such a great job at finding a few people that are sympathetic, whether they be veterans, whether they be older people struggling with some illness, whether they be young kids who maybe benefit from CBD oil because they have, intractable seizures. And, we've seen CNN do this with Sanjay Gupta, where I don't know if you've seen these weed documentaries he's done, where, you tell that story and it's very impactful. And you think like, wow, like this is, but you're not really seeing the actual numbers and the studies and imagine the stories behind all of these studies. Veterans, I just mentioned, we know that marijuana is not good for PTSD symptoms. And yet we see commercials, we see people in different states standing up behind podiums, veterans being paraded, that this can help PTSD. We need this for our anxiety. We need this for our nightmares. We need this for the stress that's caused on the battlefield. And when you actually do the studies and you look at it from Yale University and Clinical Psychology Journal, et cetera, it does not look good at all. And yet, I don't think the American people are seeing this. And that's the problem we have, is how do we communicate with people in an effective way that's broad enough? We know that youth use, a recent study showing that contributing among youth with mood disorders to things like self-harm, all-cause mortality, death by overdose of other drugs, even homicide, which, the idea that you're going to connect marijuana with things like homicide and crime was something that would have been laughable 40 years ago, because doesn't marijuana make you like peaceful and jokey and kind of chill, or just fall asleep on the couch or something? With today's THC, we are seeing things we have never seen before. And, you should just do your own research, but even if you look at if you look at a lot of these unfortunate mass casualty events we've had in the US, I just invite you on your own, and I'm not making any inferences, but on your own, look at the substance use history of these perpetrators. I'm not saying this is causing those things. There's multiple causes. Certainly different laws related to handguns, et cetera, are going to cause that, probably. But look at the history of this, and you'll find, remarkably, the role that marijuana has played in some of these major mass casualty events. I don't know if it's a causative role or even an important role, but it's there, and it's just totally turns on its head, I think, what a lot of people think about when they think about weed. This issue of opiates, we hear a lot that, well, maybe marijuana will replace opiates, so young people don't have to, or anybody, they don't have to take these horrible pills. Instead, they can take marijuana. Well, there have been study after study looking at that. This is still 2 years old, but I thought this was really interesting. It was looking at young adults and asking them why, the connection between marijuana and other drugs. And you can read their answers, but it was very illuminating about just kind of how marijuana wasn't enough for a lot of them, and how actually just wasn't doing it. And that is sort of confirming some of the early evidence we have on biological evidence on the sort of link between marijuana and other drugs, that maybe there is something in the brain that's triggered, that's turned on, but doesn't by marijuana, but doesn't get fulfilled by that, and you need to go to something else. So it's very interesting. There have been multiple studies about opioid use in marijuana, and actually it's finding that people are using more opioids when they use marijuana, not less. Yet the conventional wisdom is they'll use less because they're using marijuana. We're not seeing that at all. Study after study. I just very quickly, I don't know how much time we have. Maybe you give me because I could just be up here for hours. And you'll get more than one CE. What do we have, about 10? 10? Great. So, I think it's interesting, or it's important, I should say, that people understand that the lobbies are linked. And when you look at the vaping lobby, so you all know what Juul is. Most people don't know that Juul started as a company called Prume, actually with a person named Nick Pritzker, interestingly enough. And that no comment. And that's a marijuana company, Plume. And then they decided we got to make more than just a marijuana vape, we're going to make a Juul. But these are companies that are at their birth starting together. And why that's important is to understand that we're allowing essentially tobacco companies now back in the game when, I thought we had learned our lesson about, sort of letting them back in the game at all, but we are. So right now, these are five of some of the biggest tobacco companies in the United States are fully invested in the marijuana business. We have a place on our website where you can go and click on the company and to understand what they're doing. A couple of years ago, Altria, Philip Morris, that's their name, Altria, made about a $2 billion investment in the largest marijuana company in Canada, which is now, by the way, totally falling apart. Interestingly enough, the marijuana industry, even with all the positive PR and publicity they're getting, it's falling apart insofar as some of the bigger players are still there and they're going to thrive. And this is what I worry about. Again, when you talk about commercialization, we're talking about big business corporatizing addiction. And it's a lesson that we just won't learn from alcohol, which, I'm not a prohibitionist of alcohol, but you cannot make an argument that alcohol has a positive social benefit on society when you look at the costs that alcohol incurs on society. We've just made a deal with alcohol. I said, we're willing to take the loss because we want the liberty to drink. I get that, but that doesn't take away from the effect that it has. Obviously, legal tobacco and, of course, opioids. Those are all legal companies, and they're all investing in marijuana. All of those industries are investing. So in many ways, big tobacco is now big marijuana, I think. And we're now learning that. There's just every week there's some kind of deal between either tobacco, alcohol, and marijuana. We're seeing it just really on a weekly basis. It goes on and on and on. Molson Coors, it just keeps going. And I just very quickly, in like 2 minutes, I want to review. I think it's really important to understand our history again. I keep going back to this about the playbook of big tobacco because that is being repeated right now. And the playbook of big tobacco has a few, elements to it. Number one is to say it's medicine. And for years, by the way, we called tobacco and cigarettes medicine. And it sounds shocking. But we had a health cigar. We had asthma cigarettes. I'm not kidding. This was real. And so, we had advertising from all the major actors you could ever imagine, celebrity endorsements, sports stars, the top of the top, A-list, entertainment, sports, etc., endorsing tobacco. That was also very important. So celebrity endorsement. Some of this got misplaced from the formatting, but that's what we had. So celebrity. We had kid-friendly cartoons. Let's get the cartoons involved. Literally Fred and Wilma Flintstone. That's not photoshopped. That's real. This was real. Babies and kids advertising cigarettes for new parents, for new moms. By the way, I don't have slides, I don't think, here on the risk to women and offspring and the prenatal exposure. It is incredibly devastating. Every month there's almost a new study on how devastating it is. And yet rates among pregnant women are skyrocketing because they're getting the impression that this can help. That this can help with nausea, this can help, when in reality we're seeing low birth rate, we're seeing death, We're seeing studies that show that if you expose your baby to THC, that actually could precipitate heroin seeking later in life. I mean, it's incredible what we're seeing, and yet, we're not doing anything about it. So kids and young people, fun. I mean, all of this stuff. We'll make it fun. We'll make it cool. It's great spirit. I mean, these people are having a blast everywhere. I mean, sort of using sexual imagery. This is like in our lifetime again. This is not 100 years ago. And yet, free giveaways. Remember all the bags and shirts and all that. Tobacco did that. We're seeing all of this with marijuana. So we're seeing the medical side, Dr. Reefer, the marijuana doctor. We all know about the medical side. We're seeing the celebrity endorsement. Every day there seems to be a new celebrity. There's a new write-up, only glowing write-ups about how cool it is that, Seth Rogen has his own line of marijuana. I think there was a 5-page New York Times Magazine write-up about that, like with nothing about the potential downside. I mean, they didn't even have a sentence in there. So we're seeing sports stars embrace it. We're seeing sports leagues, unfortunately, embrace it. Teresa Haley, who I want to introduce all to you, wave your hand, Teresa, is the president of the NAACP in Illinois. And I've had the honor of working with her for a number of years. We wrote an op-ed in the Chicago Tribune a few months ago about the NBA going this way. And they were getting so much pressure from the Players Association. So they finally relented and said, all right, we're not going to test for marijuana, but if you have a marijuana problem, you have to go to treatment. But basically, we're not going to know if you have a problem unless you admit it or something, or if coach might identify it. And you can't endorse marijuana, like you can't be the spokesperson, but you can have like some shares in a company. I mean, it's just not good, basically where it's going. But this is again what we had for tobacco for a number of years. This is a hockey a team, and it's sponsored by a marijuana company. And they sort of mock the leaf a little bit to not make it look totally like a marijuana leaf, but that's what it is. And using things that are kid friendly, and social media. I mean, good luck if we think we're going to regulate that and get like social media influencers to not endorse marijuana and not that's very difficult to do. So we're now contending with all of this now, the influencers, the sexual imagery as well is very, very, very strong in the marijuana culture. And the giveaways are very strong as well. So it is literally the exact same playbook. And what's weird is that I kind of thought we had learned our lesson from it. And in reality, we're just falling for the same thing. And this is part of addiction for profit. This is part of what I was talking about. Alcohol industry revenues, the majority of them come from 10 to 15% of drinkers in this country. So they don't need everybody to be drinking all the time. But they encourage heavy use. They want you to be a regular customer. I mean, like any business does. So the idea that we're kind of leaving this up to sort of business to regulate, it's in their interest to not want people to be responsible. So when you hear even from the alcohol industry, sort of enjoy responsibly, I laugh at that because if everyone enjoyed responsibly, we wouldn't have an alcohol industry the way that we do. This is the latest data out of Colorado. It shows that 30% of people consume 87% of the volume of marijuana. So it doesn't have to be the majority of people, but a third consume that much. Those are the heavy users. That component is very, very important to this industry. It's how they make money. I'm very concerned about the effect of this on disadvantaged communities. And Teresa and I have worked on those issues together. Maybe she can speak to some of that during the Q&A. But we're seeing public housing. The numbers in public housing are, when there are surveys that are not, then there are not many surveys done. They are so devastating to see the rates of exposure to second and third hand, but secondhand smoke among young people, and what the 9-year-olds are telling researchers, what their everyday is like, is really, really, I think, problematic. The poison control numbers that are going way up, and what I mean by poison marijuana exposures is 5-year-old gets a hand on a gummy and has to go to the ER. Or an adult thinks that they could handle a whole muffin with THC because they did that in the 70s. They had brownies in their dorm room. What's the difference? And in reality, 30 minutes after eating that muffin, they have a complete psychotic break. We're seeing that a lot. It is completely a fallacy to think that we can regulate this, that we are regulating it. In my book, Smokescreen, I interviewed lab owners. I interviewed owners of marijuana production facilities. There's no oversight. It's just window dressing, because the state has to say that there's some kind of regulation. When you actually test these products, when you test them for heavy metals and lead and pesticides, things that we wouldn't allow in any kind of retail setting, you would be surprised to see what we're seeing. And sometimes, unfortunately, the media investigative journalists have been left to investigate this because the state isn't not doing it themselves. It's not in the state's interest to say that things aren't going well in this business, because they are trying to encourage revenue, which is obviously, I think, problematic. This is James and Charmaine Hayes, who we worked with in Compton, California for a number of years. And basically, they are one of the few people one of the few places, actually, one of the few communities of color that have pushed out marijuana stores. They did not want marijuana stores because they said, we already have a difficult hand in life of the kids in this community. Marijuana is not going to help them. And we don't need to be targeted by an industry again. By the way, in legalized states, the arrest rates for marijuana are still disproportionate, so that didn't change. Prison rates did not go down because of this. And what we're actually seeing is that people of color are actually not benefiting financially from this industry at all. That the people benefiting are looking a lot more like me. And that this idea that we sort of are going to open the doors to wealth through the marijuana industry, we're going to give licenses to disproportionate people who have been disproportionately affected, I think is backwards on so many levels. Number one, why is marijuana the only place that we're talking about helping people of color advance in economic society? Like, does it take the marijuana legalization to have that conversation? Like, if that's the case, that tells a lot about the society that we're building. But also, it's a complete fallacy to think that somebody without access to capital, without access to millions and millions of dollars, without political power and access, is even going to be successful in the marijuana market today. And so it's not a surprise that all the media groups that, like, basically, when we said this 10 years ago, kind of looked at us and said, nah, you're just, crying wolf, whatever. Now they're writing the articles that we couldn't write headlines like this if we tried, because it's exactly what we've been saying for a number of years. So they remain very rare. There's no equity licensing. That's not happening at all. You can look at the number of Black-owned or Latino-owned businesses. It's just not happening. And then I think the worst part is when you look at the proportion of the marijuana stores in terms of where they are in our communities, they are in poorer, more disadvantaged areas by and large. And that is not surprising, because where are the liquor stores? Where are the checks cashed, at the low interest rate of 32.4% monthly? Where are the places where you can't find a head of broccoli for 10 miles? Marijuana fits right in. Lottery, marijuana fits right in to all of this. So when you look at Denver, you look at the concentration, it's in primarily disadvantaged communities. You look at California, it's in primarily disadvantaged communities. Communities that have more resources, frankly, those are the ones that are able to often block it from happening. I actually know there's a very big fight going on right now in Lincoln Park that we've been asked to help with. That's a very interesting case. But that group in Lincoln Park, they have $100,000 to spend on a lawyer to fight this. I mean, they raised it in like a few days. That's not the case everywhere else. And so there's a huge element of social justice that we're not talking about. That doesn't mean that we want to lock people up for using marijuana. I want to be very clear, if I haven't been already. It's a false dichotomy to think that you either have to lock people up, criminalize use, or you have to commercialize use and sales. That is a false dichotomy. There are ways where you can not criminalize use, you can expunge records, you can give people opportunities, real opportunities, without having to go over the edge, in my opinion, and commercialize all of these products. The last point is that the underground market has not gone away. Drug dealers have not gone and become dentists since legalization. I wish they have, but they haven't. There's more than ever. The underground market has exploded, and you might think, well, how is that the case? When you increase the demand for something, you increase the market, you increase the supply on both the legal and illegal side. And that illegal side, your drug dealer isn't going away because he can sell you or she can sell you that marijuana or whatever drug at half the price. He's not taxed. He doesn't have all the regulations. And he's not being prosecuted because there's like a total hands-off of all kinds of prosecution of marijuana and frankly a lot of other drugs. And so there's no fear of that. And there's no, it's funny because if you really want to legalize marijuana, I've told people like, you better invest heavily in law enforcement to enforce the legal regulations and get the illicit market out. And of course, that's not happening anywhere. No one wants to do that. So, and drug cartels are not going away either. I mean, drug cartels are involved in this, in our hemisphere, in human trafficking, in logging, in illegal mining, in all kinds of things. Fentanyl, cocaine, obviously, methamphetamine. But the idea that they're sort of not diversified, that they're just, all their money was in marijuana, and now they're just going to go away because your state has decided to grow some, clearly that is not happening. They're bigger than ever. In fact, in some ways, when you think about what happened in Mexico, Mexico has turned, now that California and some parts of the U.S. are growing so much marijuana, they have, some of the Mexican cartels have stopped marijuana, but they haven't gone home. They just switched to opioids and fentanyl. So we can thank that for happening as a result. There is a huge illicit market for tobacco, as many of you know, and cigarettes have been legal. So when we tax something, you have that underground market. That does not go away. Anyhow, so there's a lot more we could say. Youth exposures, hospitalizations, the brands that are going on. The exemptions from the Clean Indoor Air Act that the marijuana industry is seeking. They want marijuana use in some lobbies of some hotels. They want it on the rooftop now. They want it on the outside at the mall. They want a section right outside the airport, just like smoking, tobacco. So they want it inside the airport in a special room. I mean, so we are now, after all the progress made for decades, that people blood, sweat, and tears to get clean air inside and out, those gains are being reversed. And that's something that I also really, really worry about. So false dichotomy, as I mentioned. We should not conflate decriminalization with legalization with true medical use, but those are often very, very conflated, which I think is really contributing to part of the confusion. And I'm going to end with this quote from The Economist that I like, which is, while lab animals are an expensive way of understanding the risks of cannabis use, North Americans come free. So we are undergoing a grand experiment on our kids, on our communities that don't have resources if things go wrong, don't have access to treatment like they should, or prevention. And by the way, it's not like marijuana has been commercialized and at the same time we've invested in prevention and treatment, unless I'm wrong. Unless all of your salaries have gone way up and the demand, you're able to fill all the demand. But we haven't done that. I don't see anything discouraging young people from using. At the very least, they could throw a few bones at that. I don't see a thing in any state. And so, we're sort of wandering around in the wilderness, wondering why we have 110, probably much more than that, because the numbers are so late, 1,000 people dead from overdoses. We're wondering why homelessness and all these things are skyrocketing in certain cities. And yet, we're not really looking at a lot of the core issues. But I do think there are solutions. I do think there are things that we can do. So it's not all doom and gloom. I think if we truly invested in prevention, early intervention and treatment, recovery, smart enforcement and international efforts, we actually can make a dent in a lot of this, and especially with the marijuana issue. Because I'll end with this, addiction is a brain disease, but it's a unique brain disease. Unlike Alzheimer's, for example, it's a brain disease that does respond to incentives and consequences. If you told an Alzheimer's patient, I'm going to give you $1 million tomorrow if you remember my name, that doesn't affect the behavior. They're not going to, unfortunately, remember your name because of that. But if you talk to someone with a substance use disorder and you have positive or negative consequences, carrots and sticks, we can change behavior that way. And it can be done the right way, in a humane way, in a way that doesn't imprison, in a way that doesn't dehumanize, in a way that doesn't stigmatize users, but in a way that actually gets them to change their behavior. And I think if you zoom out drug policy right now, there's a real struggle because we do see these deaths, and there are very well-meaning people who think we're never going to stop it, so we just need to make drug use safer. We just need to regulate it and make it safer. Whereas I would say, I think there are over 40 million people in recovery from addiction in this country who are living examples of the fact that we can overcome and we can do a lot better than just making drug use safer. We can actually help people live very productive lives. Thank you. Appreciate it.
Before we wrap up with the case, I'd like to introduce Teresa, who is the Illinois president of the NAACP, who we're just honored to have here from Springfield today.
Thank you.
Welcome.
I just have a couple of things that I want to say. A couple of years ago, how we got involved in working with Kevin's group, and it's truly been a blessing. It's a ministry for us. Black people and other minorities are dying at a higher rate than anyone else. The NAACP was the only civil rights organization in Illinois that said, plant the seed, say no to weed. And that was something that I came up with because we were meeting with young people and they were talking about, what if I'm going to college and I smoke weed? They didn't realize that they were going to lose their scholarships. People are losing their lives every day because of weed. And dabbing is one of the things that I would encourage all of us to educate ourselves about and our young people. Last year, my granddaughter tried to commit suicide after using a dab pen. Does everyone in this room know what a dab pen is? When you're smoking and you're using a dab pen, one dab pen equals 7 joints. How many people in America do you know that sit down in one setting and smoke 7 joints? It just doesn't happen in America. So we have to educate our community and educate our young people. The other thing that the NAACP fought against is the fact that when they were talking about marijuana was going to be a great thing, especially for black people and poor people, those who were impacted with the war on drugs, it turned out not to be so great. And we knew that they were lying when the big people were coming to us and saying that we were going to give up to 25% of the monies collected from marijuana usage back to the communities who were directly impacted. We haven't seen any of that money. We don't have any black or brown dispensaries in the state of Illinois. Not that we want them, but if everyone else is benefiting from it, why shouldn't we? There are some people who smoke weed who believe in it and they're going to continue to do it. We can't stop it. But what we want to do is to be able to educate people. And if Illinois is bringing in all this money, billions and billions of dollars, truly go back and give it to the people who were directly impacted. Because what we decided to do is that we would expunge your records, but it doesn't mean that you're going to get a job. It doesn't mean that you're going to own the building. I called it modern day slavery, and it pissed a lot of people off, and I didn't care because it was okay for black people to plant the weed, grow the weed, clip the weed, and bag the weed and sell the weed for someone else, but we couldn't do it for ourselves. And with the war on drugs, more black and brown people went to prison than any other group of people. With COVID, a lot of them died. They weren't able to get out. 3 strikes was real, and it's still impacting the black and brown community, as well as the white community, and we don't discount that at all. But what we need to do in America, and what we're trying to do throughout the state of Illinois and other countries, as soon as Kevin calls and says, hey, they're talking about having marijuana legislation, and we know what it did to Illinois. Can you meet us down in Little Rock, Arkansas? Or can you go down to Alabama or somewhere else? So whenever he calls, I'm there. Because people need to see people who look like me, who grew up in those type of environments and planted the seed and said no to weed. But thank you all for listening. I appreciate it.
That's going to be a hard act to follow. I'm going to start by teaching Dr. Sabet a term it sounds like he was not aware of. They go by bud tender. Oh, yeah, bud tender. Yes, not bartender or barista, but they prefer bud tender. So, and actually, one quick point, I think one of the things that was missed just very briefly in the IQ slide, obviously a pediatric psychiatrist and so very biased in this domain, the point of heavy usage was 3 to 4 times a week, right, over the course of high school. Most of the patients that I see are hitting that by noon on Monday, right? Not by the end of the day on Sunday. And so this magnitude of losing half a standard deviation, this large, absolutely very meaningful 8-point IQ drop is for, a time frame when kids were using a tenth, maybe less, than what I routinely see now. And so, the data that we're seeing is already bad. The data that's coming out is only going to be much worse. All right, so just to get back to our patient from before, I know there's a lot that's happened in the meantime, bringing it back to our 16-year-old female who came in to us with the depression and generalized anxiety diagnoses. After the discussion with myself, taking a look at what was going on, diagnoses were revised to include an other specified feeding and eating disorder related to the food restriction and the binge eating that was going on, cannabis use disorder, severe and severity, and then generalized anxiety disorder switched over to a social anxiety disorder that we know is a huge harbinger for both cannabis and alcohol use in cases where kids are around other kids and having that intense fear of anxiety or that intense anxiety around judgment. Both anxiety and cannabis are very prevalent in those situations, and they help in the moment to bring the anxiety down. It's actually one of the single greatest risk factors for going on to develop cannabis or alcohol use disorder is the presence of social anxiety disorder, and a really common disorder in adolescents just generally. And then lastly, this other specified trauma and stress-related disorder related to the history of physical and sexual assault in the past, in addition to clinical depression, which this person absolutely did have. So one of the things that we saw over the course of treatment here is that this patient in particular was in fact using THC for social anxiety. They were also using it with this desire to feel cool and feel better about themselves. Somebody who has a very low self-concept, largely related to the trauma and history that they'd had earlier in life. They're actually an extremely personal, very charismatic adolescent. Somebody who I know is going to go on to do some pretty impressive things if I was to have to guess. But to themselves, they see themselves as a zero, and that's kind of what the world has told them, despite the fact that so many people provide them evidence to the contrary. And then, of course, as they were using the THC for this social anxiety, they'd find themselves having periods of binge eating that resulted in them wanting to restrict their food intake more, which further impacts their ability to do cognitive and executive functioning during the day, both related to the calorie restriction during the day, as well as the impacts of THC being used on a daily basis, impacting that cognitive and executive functioning. And then, okay, I covered the trauma part on there. So the course of treatment for this patient, and why I'm presenting it to you today, is because things did end up going extremely well. They were in this situation where they said, hey, people haven't talked to me about this before. I didn't realize how big of a problem this was. It seemed kind of like a normal thing to me at the time when it was getting going, but I have recognized that things have gotten a lot worse in my life over the past year, and I'm trying to put the pieces together. And so sometimes, just like Dr. Sabet was doing here today, having that education of, you are taking what was already a really tough battle to get through the day and deal with your trauma, deal with the depression, and you're making that, into a giant mountain with the added on eating disorder components and the cannabis use disorder components. This individual is able to remain sober throughout all of treatment, and we kind of had that expected thing where as you get further and further out from last use, you get more and more of your cognitive functioning back, your executive functioning back, your personhood back, and that was absolutely the case for this individual. Now, their anxiety, as I mentioned, was quite severe, and this was not a person who, had some mild anxiety issues at all. They were very prominent thoughts when they were in social situations, very hard to get out of. So real quickly from the med standpoint, not of interest to all of you in here, but their Prozac dosage was increased by myself in treatment very early on. And then we're finding that still wasn't enough to have things go in the right direction for them. And this is the case I see in a lot of adolescents that have severe substance use disorders, particularly the central nervous system depressants, and obviously this day and age, that's overwhelmingly cannabis and to a lesser extent alcohol. And so for those adolescents, we're often needing additional medications to help with the anxiety. A modest dose of gabapentin that was added, and this individual found a significant improvement in their anxiety symptoms as a result of that. They no longer felt the need to use THC to manage anxiety as they're getting back into some of those social situations, but they were still really struggling with their identity concerns and feeling like they wanted to fit in and have worth, and having not a lot of that driven internally and really seeking outside sources to find that worth and that identity. But as a course of treatment, as they were able to learn to eat regularly, the binge eating entirely subsided. They were eating regularly throughout the course of the day. They were able to identify the previous trauma and figure out how that impacted them and work on recovery and taking back the control that they lost from that. They were able to get to the point of detaching from negative romantic relationship. A lot of adolescents, are seeking to get that reinforcement and being told that you matter and you're important from somebody else in a not so healthy way. That was absolutely the case for this individual, and they were able to, kind of say, hey, this is not the right thing for me. I got to work on myself, A, and B, what you and I are bringing to the table is a net negative, and walk away. And that's not easy for anybody to do, if you're 16, 36, or 56. So a really impressive move there. As I mentioned, we were able to see, ongoing improvements in the executive functioning with this individual, how they were structuring their life, getting back into the workforce, getting back to interact regularly with friends who were good influences on their life, as opposed to net negative influences on their life. I don't usually get a lot of quotes from my patients, but I just happened to on this individual. They're very quote-worthy. And so during our last session, these are just direct quotes that they told me as a result of them being in treatment here for approximately 3 months. They said, I don't need other people to be happy anymore. I don't need external validation. I don't rely on drugs anymore. Regarding their social anxiety, they said, I can adapt. I'm considering doing things I would never consider before. They're planning on going to an open mic, which actually terrifies me, and I do not struggle with social anxiety. But that's how far they had come with regards to that. And just generally their view of the whole world, they said, I feel kind of bad now because actually I think the world's a great place to be, and I really like my life, and I just didn't see it. And so that was the kind of change for them as a result of their treatment here with us. So with that, we'll open things up for questions. Thank you all so much for coming today. I'm so glad you could be here with us. And yeah.
Why don't two of you stand? I do want to say that this is not the typical adolescent patient, right?
Sure, that's,
We don't have any magic Kool-Aid here at SunCloud Health where we have adolescents using cannabis who are like, hey, my life's a lot better without it. Typically, for all of the reasons that Dr. Sabet said, it's, one of the things that makes it so hard to treat is because the bottom is blunted. I use that term purposefully, right? Like it's like the frog in the water. You just tiny increments of increasing that temperature until it's boiling, and the frog's like, it's not that hot in here. Maybe a little hot, but I'm good, right? And that's what I've sat in adolescent groups, and it's excruciating. It's extremely difficult to gain insight because it's, all of the advertising, what their parents are telling them, all of that. So we have time for questions now. We have lunch afterwards. I'd like to start the questions with particularly when we think about marginalized populations. Are there studies showing disproportionate impact of cannabis use disorder on kids of color in our country?
Yeah, no, there are studies that show that. And if you think about why, we know that recovery from addiction and also not using and trying to move on is a combination of factors. It's not just genetics, but it has to do with your environment. Do you have a supportive community? Do you have supportive education, housing, access to health care? All of those things factor into a person's decision to continue to use or not. And because of a lot of these structural problems that we have, that's why we call them disadvantaged communities, because by definition, they are disadvantaged. Those communities are affected more, absolutely.
Okay. Other questions? Yes.
I work a lot with people going out of college and whatever, and this is often part of it. But when the University of Colorado faced the law changes, they bring out a guy from Harvard, doctor, to talk in orientation to the students. He's telling them all these things that are going to get in their way, executive function issues, the IQ stuff. He said they never stirred, they were bored, until he said testicular shrinkage.
Yeah.
And I don't think there's the press. Where are the people putting on a special, where's Anderson Cooper talking about it on CNN, that we could be destroying reproductive capacity of future generations.
It's a huge issue. No, I agree. We know THC affects the reproductive system in very specific ways for both men and women. And we know the lower sperm count, the testosterone issues that men have. Yeah, it's a big issue. And I have heard that story in relating to other kids before too, because it's like, how do we get through to younger population? You could talk about data all day, but it's very difficult. That one I've heard. Also, the way to get through is often just talking about this industry that wants to make money off of their brains. And a lot of young people they resent that. They don't like that. And when you present it in that way, it becomes difficult because they're sort of anti-corporate, that, but then how can you be that and pro-marijuana? Those worlds kind of collide a little bit, and it's important to sort of know your audience.
I think that's a really important point. Kids, adolescent males, probably adult males too, really pay attention when you mention testicular shrinkage.
Yeah.
Other questions? Joe.
Yeah, I'm wondering how this computes with individuals that's into sports. And you mentioned that sports and some of the other advertisements they're doing. Do we have anyone? Do we have any sports figures that actually talk about I understand that Michael Jordan is one of the bigger proponents of investing money into marijuana farms and whatever. So, do we have anyone that does just the opposite?
I think that there are some, but they are they feel like they can't really speak out. But that question is one that we're actively now trying to identify who those people can be, because we've heard from Kevin Durant about how much he's investing, and we've heard from so many people. And so it's something that's on my mind.
Okay. Do you have you have people in mind that you're going to solicit to kind of do just that?
We're going to try.
Okay.
Yeah, it's hard. It's a challenge.
I just wanted to say, I'm just really appreciative of this presentation, and how much you were able to pack in.
Sure.
Because I think that right now for us that have worked in the addictions field for many years, it is so diluted, with these concepts and permissiveness around weed and some other drugs too. And I've been to international traumatic stress society conferences where there's more presentations that are about the use of drugs in sobriety, and that and also just being one of the baby boomers, this brought back a lot of memories for me too, of the kind of movies that we saw back then, that really some of the same data was available back then, and when you're talking about this potency, and about just one of my patients who's a therapist yesterday shared that she referred someone for testing, and the psychologist doing the testing called DCFS because the child said, "My mother gives me weed." And the child was shocked, of course, that all this happened. And I was just thinking about all of that too. Like, I'm quite sure DCFS does nothing about that, and I'm not sure that we want them to, because it often gets worse. But it's a lot of thinking that you brought to us.
Thank you. Glad to hear that. Thank you so much. Appreciate it.
I'm too am one of the boomers, actually. and another thing, I don't know currently, insurance companies acknowledging marijuana addiction, because prior to, years ago, they didn't, acknowledge, marijuana as being addictive.
Yep.
They're more gracious with adolescents.
Yeah.
Okay.
But some of our adults have what they call primary. What insurance would say, what's primary? Usually it's, well, which 5 do you want? But even with some of the adults, I think because it's so severe, with dabbing, with the high potency every single day, multiple times a day, we're having psychotic symptoms, profound mood symptoms, that we are getting insurance authorizations. And again, this is like private insurance, right? So what about all the people on Medicaid and Medicare?
One other thing that I just wanted to thank you for is bringing up the community traumas and mass shootings, and there absolutely is. I've seen that too, and we had one here in Highland Park, a parade shooting, but that, and that, the shooter in that case, heavy marijuana use. Parents
As an adolescent.
Yeah, exactly, and parents providing guns and drugs.
Yeah.
Right. So.
Speaking of which, actually, Highland Park, I'll be speaking there tonight in Highland Park at the Wayfarer Theater. It's the old theater that Wayfarer Studios just bought. So they renovated and redid that whole theater. And we're going to have, it's either going to be at 7 or 7:30 tonight, and for young people as well. Actually, it's aimed at young people and their parents, but really anybody can come. It'll be a small group, but and it's free. So and it's a really neat, really cool theater that they've restored.
Yeah.
It's kind of neat to just see that. But anyone, you're all welcome to come to.
Yeah.
I just wanted to add something. I really appreciated the slide about the emergency room, or it was poison control,
Yeah.
but emergency room
Yeah.
I'm sure is
Yeah.
right up
Yeah,
there
yeah.
too. And another number are pets.
Oh yeah, that's a huge issue. Yeah, I mean there were a number of things I didn't talk about. Yeah, absolutely. The pets issue is big, and it's accidental exposure of pets. That's
And
it's
they,
like
they die. Like,
they die. Yeah,
They don't.
yeah,
survive.
exactly. And it's interesting. We did a focus group where we showed a commercial with a little girl getting gummies, and then one with the dog, and you could rate it. It's like a biological test where you see people's heart rate and the emotional response. It's a lot of polling. They do that, and the pets was much more of an emotional response than the 5-year-old girl getting a gummy, because we care about our pets a lot in this country, a lot, as much or more than our kids. I think, and this poll showed that, because these people were getting very emotional and stressed out and upset at that image, that video, more than anything. And so it's a very important issue to talk about. Yeah, I didn't bring it up. Thank you for mentioning it.
Get young people.
Oh, definitely. All kinds of everybody. I mean, it's widely viewed. Thank you.
I was going to say, don't forget to mention the seniors who did not use drugs, and now they're
Yes.
retired, they have arthritis, they have
Yes.
dementia,
Yes.
and some of these other things, and they're not letting their families or doctors know.
Yes.
They're
Yes.
closet users of marijuana, and they're having all kinds of negative
Absolutely.
impacts. So
Absolutely.
we have to talk to your parents, talk to your friends. I retired from state government. We had a drug-free, alcohol-free workplace, but now that they don't have to go to work anymore, and marijuana is legal in Illinois, and they
Yeah.
got that little pain in their knee, and they're
Yeah.
telling they need a hip replacement,
Yes.
they're taking these gummies.
Yeah.
Yeah.
And it's impacting their medication.
Yeah.
So
Yeah.
pay attention to those.
The highest rate of marijuana and hallucinogenic use for those over 65 ever in this country was last year.
Yep.
And they didn't use it before.
No.
But now they can experiment because they're not being tested.
Yeah.
Yeah, and in Illinois, medical
It's just
is in quotes because they're like 3 evidence-based, issues to use
Yeah.
THC for,
Yeah.
right? Cancer, spasticity associated with Parkinson's disease, and neuropathy, diabetic neuropathy. That's it, and in Illinois, the list of like lawmakers' marijuana before it was legalized is about 40 conditions long, including PTSD, including addiction, including anxiety, including depression, which we know from the literature, from everything that you showed, makes those conditions worse. And we have seniors now thinking, who came from an age when these things were illegal and they didn't want to do illegal things, are now like, well, my doctor told me to, my marijuana doctor told me to just, if I get a card from my doctor, I don't have to pay the tax difference on it. So,
CBD, that's
Oh, yeah.
really being promoted a lot with seniors, actually. Have you tried, CBD oil, for pain and,
Right.
depression and
Yeah.
whatever?
There's no evidence that CBD for pain is effective. There's no evidence it's effective for depression. I think it's the ultimate placebo. It's the ultimate sugar pill. People, when you ask them, they feel that when they think they've taken CBD, they think that they feel better. And the evidence on CBD oil is basically with regards to uncontrollable seizures that don't react to normal medication. That's actually a prescription drug by the FDA that's available now. Right. But the reason you're seeing CBD everywhere is because there's been a loophole in the federal law on hemp that allows hemp is a cousin of marijuana, hemp-derived substances. That's why you might see Delta 8. If you've seen Delta 8 gummies sold at the gas station, or Delta 8, very, very harmful and very dangerous substance. It's a synthetic marijuana. It's very dangerous. But also hemp-derived CBD, is legal under this loophole in the agricultural bill. And so that's why CBD just has been proliferating. But there is some sizable literature, growing literature on liver damage with CBD. And so I just always tell people, buyer beware. I mean, at least talk about it with your doctor. Most doctors by the way, are not trained. They don't know. So that's unfortunate. Yeah, they might just say, if it makes you feel good, go for it. They don't know the research on the liver damage. But I think for a lot of people, it's seen as placebo.
What do you say to people that listen to you talk or look at your organization and say, this is just like Nancy Reagan, conservative,
Yes.
racist.
Right. We've been called everything.
Fear-mongering.
Under the sun. I just tell people to not take my word for it. Look at you don't have to listen. Don't agree with us. Don't donate. But look at the science yourself. Look at what every major medical association is saying. I mean, our organization goes out of its way to be bipartisans, but yes, people will still say that. Or even worse, they'll make false accusations about our funding. No, you must get funding from Big Pharma. We've never taken a penny from the pharmaceutical industries. We don't, because that obviously it's a bad look, and we wouldn't want to do that. It would look like we're trying to promote one drug and not the other. And so we've been very careful about that. But yeah, I mean, there's a very vicious, I hate to say vicious, but it is, movement to legitimize this stuff, because we're kind of going after their bottom line. We're going after the almighty dollar, their profit margin, and they don't like that.
Yeah. Well, and I think like Teresa mentioned, like you said, with the sort of consolidation of the big, big tobacco, big marijuana companies, we are not seeing people of color represented in those boardrooms, right?
Yeah.
Like that's not who this is benefiting.
Yes.
And Lauren in the back.
Could you speak a little bit, because I feel kratom and like Delta 8 is like specifically, I feel is just really out of the conversation.
Yeah.
But seems to be just as harmful or
It's different,
effective.
but yeah.
I don't know if maybe why.
Well, kratom has, through another loophole, become legal somehow, and so and then it's very unknown, but essentially it's the kind of drug that in some doses is a stimulant, in some doses it's a depressant. It's a very strange drug. It's derived from a plant. But there's an entire Kratom Association of America right now that essentially has been hiring all these ex-drug policy officials, I hate to say it, some of them I know and are my friends, who are saying, this isn't that bad, and let's do research, and we don't want to have any adulterants in it, but if you just take pure kratom, maybe that'll help you off, get off opioids, because it does help some people with opioid withdrawal. And so it's being touted as maybe it can help us with opioids, when in reality, for a lot of people, it is addictive, and I have seen reports, some anecdotal and some non, that show that its addictive potential is very high, and it's a very difficult drug to get off of. There are some really scary stories from parents about kratom, but it's something that we do need to study more and look at. You're right; it's often out of the conversation, and it shouldn't be, because it's so widely available. And Delta 8, which is extremely dangerous as well, needs to be more in the conversation.
Is it something though, Delta 8, that you would talk about like as if it was marijuana?
No, I talk about it separately. It's because it's a synthetic that's created in a laboratory. It's basically what they did is take the Delta 9. The THC is Delta 9 THC. When we're talking about THC there, I didn't make that clear. That's actually Delta 9. That's THC. So they basically altered the chemical structure of THC. It's Delta 8. And we don't have a lot of research on it, but what we have is not good at all. And in some ways, for some people, it's more harmful maybe than Delta 9.
And certainly more ubiquitous at the gas station.
Yeah, exactly. Very easy to get.
And
Yes.
as a treatment provider, you can't test for it, right? I mean, there are certain tricks that you can learn but there's no specific. You can't get a quantitative level of how much.
Are you
Delta
seeing
8
young
is.
people here with Delta?
Oh, for sure.
A lot.
Absolutely.
And what about kratom? Anything with kratom yet?
I don't have
Not really.
much
Maybe
kratom here.
in young
but-
adults,
Mm,
primarily for people who are using
opioids?
opioids.
Yeah, they're told.
Delta 8, absolutely.
Practice in middle-aged adults.
Yeah.
They kind of think they lick their problem with kratom.
Interesting.
Yep.
It becomes another addiction.
Yeah.
They're recovered.
Yeah, exactly.
All right.
Thank you all. This
We're
was
going to
wonderful.
wrap
Thanks,
up
everybody.
with
Appreciate
that.
it.
Please enjoy lunch, and thank you all for coming. Thank you, Calvin and Teresa, for being here.
Thank you.
Dr. Sabet
Thanks so
and
much.
Dr. Chevalier. Thank you very much.
Thank you so much. Thank you all. Great job.
Thank you.
You were great.
Appreciate
Thank you.
it.
No, of course. Thank you. Thank you so much.